This video explains the Federal Information Collection Request approval process for the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry. Most federal workers are not fully aware of the Paperwork Reduction Act and the Office of Management and Budget's requirements for requesting and getting approval to collect data and information from the public. The first step to get a Federal Information Collection Request approval, also known as a Paperwork Reduction Act clearance or PRA clearance, is to request an initial consultation from your CIO's Paperwork Reduction Act contact. Notify your PRA contact when you use federal funding to collect information or have a project that asks or implies that the recipient collect, obtain, maintain, record, or disclose data or information. This person is your CIO's Paperwork Reduction Act expert and will discuss common forms, help determine whether or not you are already collecting the data you need, search federal government websites to research data collection by other agencies and offices, assist with seeking opportunities to conduct information collection in conjunction with other agencies or offices, and give guidance on preparing the information collection request. For all projects that involve information collection, consult with your PRA contact early in the project's planning phase to avoid unnecessary duplication of effort. Once it's been determined that your information collection project requires a PRA clearance, the next step is to draft an information collection request and use the information to draft a 60-day Federal Register notice for public review and comment. This should be done 9 to 12 months prior to data collection. If you aren't familiar with an information collection request or a Federal Register notice, your PRA contact can share examples and provide guidance to complete both drafts. The draft information collection request package should contain the following: supporting statements A and B, which includes narrative information explaining the information collection's purpose, scope, and benefits, as well as the methods used to gain information for general purpose statistics. There are 18 items for response in supporting statement A and 5 items for response in supporting statement B. Instructions for completing the information collection. Data collection instruments such as questionnaires, surveys, interview guides, telephone interview scripts, pertinent statutes or regulations. Institutional Review Board approval letters if applicable. Appropriate screenshots. Introductory and follow-up correspondence to respondents, including consent forms, letters, reminders, and other information collection-related reference material. When you design your information collection request, follow the Office of Management and Budget's, or OMB's, 10 guidelines for information collection. Ask yourself and others the following questions, and get a yes response to each in order to proceed. Is this information collection necessary for performance of agency functions? Does this information collection avoid unnecessary duplication? Is burden reduced on small entities? Does the information collection and the information collection request use plain, coherent, unambiguous terminology? Will implementation of the information collection be compatible with recording and reporting practices of the respondent? Does the information collection indicate the retention period for record-keeping requirements placed upon the respondents? Do the information collection instructions and instruments inform respondents of the information required under OMB regulations? Has the sponsoring CDC office planned and allocated resources for the development and use of this information collection? If applicable, does the federal sponsor of the information collection use an effective and efficient statistical methodology for the information collection? Does CDC make appropriate use of information technology for this information collection? You must also keep the following principles in mind before submitting the information collection request to your PRA contact. These will help ensure that the basic standards of quality, utility, objectivity, and integrity have been met. Keep it simple. Simplify the instructions to reduce the time required to read them. Keep it plain. Use common, plain, conversational language with no jargon. Always spell out acronyms the first time they are used. Eliminate redundancies. You don't need to repeat information. If background or other relevant information is located in other documents, simply reference the information. Keep it clean. Remove areas where the requested data is no longer required or used. Keep it relevant. Look at whether or not the same data requirements apply after conducting a collection a few times. Fishing is not allowed. All data collected must have some practical utility to the program. It would be nice to have, or just in case we need it, are not valid reasons to collect data. Automate. Look for ways to use information technology to automate collections. Check with others. Consult with similar programs in other agencies and with CDC's forms experts for tips on how to reduce burden. Now that you have ensured that all requirements have been met to seek a PRA clearance for your project, your PRA contact will submit the draft information collection request package and draft a 60-day Federal Register notice to the Information Collection Review Office for review and approval. You should expect several revisions of the documents prior to the release of the 60-day Federal Register notice for publication. After the Information Collection Review Office's review and CDC's PRA Clearance Officer's approval and certification, the 60-day Federal Register notice will be submitted to the Government Printing Office for publication in the Federal Register. This informs the public of your intent to ask for Department of Health and Human Services and OMB clearance for the collection of information. It also solicits comments for the 60-day public critique period. This provides the public with an opportunity to evaluate the collection's necessity and enhance the quality, utility, and clarity of the information to be collected. Test your data collection forms early and often. Make sure your survey, interview guide, or script works as intended by trying it out on a few people first. Test data collection instruments before or immediately after the 60-day Federal Register notice is published to ensure they aren't confusing or burdensome. Focus groups and/or in-person observations of individuals responding to the forms and questions, or cognitive testing, may be used to test the forms. Use the test results to refine the time burden estimate for each form. If testing involves 10 or more members of the public, get approval using your CIO's Generic Service Delivery Plan to test the instrument. After the 60-day comment period, where necessary, update the information collection request package. Updates will include your testing results, as well as the comments received during the 60-day public comment period. Your PRA contact will provide you with all the public comments received. As part of the sponsoring program, you must give serious consideration to comments received and make changes to your information collection request package as appropriate to address concerns raised by the public. Well before expiration of the 60-day Federal Register notice, and after your PRA oversight official's review and approval, your PRA contact will submit the complete information collection request to the Information Collection Review Office for review and approval. There may be discussions or negotiations by an Information Collection Review Office desk officer and your PRA contact. The desk officer will also provide comments and passback requests during this time. It is important that you respond to any desk officer requests within 30 days. If you don't, your information collection request will be withdrawn and returned to your PRA contact without further action. After the Information Collection Review Office's review and approval, they will publish a 30-day Federal Register notice and electronically submit the Information Collection Request Package to the Department of Health and Human Services for a standards assessment, compliance review, and certification. Upon certification of the package, the Department's Reports Clearance Officer will submit the package to OMB for review and approval. This second opportunity for comment notifies the public that the clearance request has been submitted to OMB, and now the public has an opportunity to comment on the final version of the information collection request. Once OMB receives the information collection request, the 60-day review period begins. Once OMB has your information collection request package, what should you do? During the 60-day OMB review period, discussions or negotiations may occur between the Information Collection Review Office and OMB. Comments received from the public during this review period can also be discussed at this time. You and other CDC program staff may be involved, if necessary, during this period, including being asked to provide answers to the OMB questions, revise documents, clarify discrepancies, or resolve issues with the information collection request package. After reviewing the information collection request package and considering public comments, OMB will issue a notice of action that will provide one of the following responses: pre-approved, approved, approved without change, approved with change, improperly submitted and continue, returned, improperly submitted, returned to agency for reconsideration, returned outside generic clearance, withdrawn and continue, disapproved, or disapproved and continue. Additionally, OMB may attach terms of clearance to an approved information collection request. The notice of action will also include the terms of clearance. Let's face it, seeking approval to collect information from the public is time-consuming. Take a look at the information collection request development and approval process timeline. From beginning to end, it typically takes 6 to 9 months. In summary, a CDC program must first identify the need for collecting information and a methodology. Then, the program must draft a 60-day Federal Register notice that addresses the following questions. Why is the collection necessary? Is the agency's burden estimate accurate? How could the agency enhance the quality, utility, and clarity of the information to be collected? And how could the agency minimize the burden of the collection of information? Once the program satisfactorily addresses the public's comments, the agency publishes a second Federal Register notice to announce the start of OMB's review and submits the collection for departmental review. It is then submitted to OMB for review. They begin their review after the 30-day comment period has closed. The OMB review may take an additional 90 days due to workload or further federal review. Issues with the information collection request package may arise and require you to revise or change the package. Significant changes may require significant additional time. Early submission is critical for collections that are time-sensitive. Your PRA contact must identify time-sensitive projects early and communicate deadlines to the Information Collection Review Office Chief. Plan ahead. The more lead time, the better for all involved in the process. The PRA clearance process is not a race. It's a systematic, coordinated process that requires effective team planning. At CDC, we have a transparent and collaborative federal information collection request approval process that allows the public to actively participate.